There. So you see it down there? So if I'm talking and trying to draw some stuff, let me know. Just hit record. So I forget. Okay, let's go ahead and get started. You said that you guys have had some information. One more piece of information that I can give you. If I'm actively drawing a tract, or if I'm drawing something, it's probably helpful. It might be helpful to use the same color or something similar. Okay, because the colors will mean something as we go forward. So what I've drawn here is, this is my basic schematic of the central nervous system. We have the brain in general. What's this part back here in the back of the brain? Cerebellum, good. Does anybody know what's this part called? Brainstem, good. Awesome, okay. So this is if I had to give this a general term, we're just going to call this the cortex. Okay, so if you're looking at me sideways here, well, I guess it's not, it looks that way this way. So you're looking at me like this, okay, that's the view. So the cerebellum's going to be here in the back. I like to think of that little, the cortical region with that little thumb piece coming out. It's like a boxing glove, kind of. Okay, so that's pointing forward, if that makes sense. And then you guys told me that this is the cerebellum. Like I said, this is just a great big overview. Lots of repetition here. You told me that this is the brainstem. Does anybody know what the uppermost portion of the brainstem is called? Oh, the medulla is in there. The medulla is the lowest one. Good. So this is going to be your medulla. Okay, what's the uppermost? Anybody?
Cerebrum.
Cerebrum is going to be your cortex, or another word for the cortex is your cerebrum. Pons is in the middle. Good. The pons is the one that sticks out. We're getting there. There's one up top. It's got a funky, yeah, that's your midbrain. Good. That's your midbrain. So overall you have your cortical region, or your cerebral regions, lots of different lobes there. We're going to talk about that as we go forward. And back you have your cerebellum. Then you have your brainstem. Brainstem, uppermost level is your medulla, middle's the pons. The lowest is uppermost is the midbrain, middle's the pons, the lowest is the medulla. Okay, and then underneath the medulla is this long thing, goes all the way down me. Spinal cord, great. That's going to be your spinal cord. Does everybody see where we are? And all these pieces form what's called the central nervous system, or the CNS. Okay, all these. So your CNS is composed of your cortical region, cerebellum, brainstem, and spinal cord. Okay, so CNS lesions happen somewhere in here. In addition to the CNS, we have this other thing called the PNS. So CNS stands for central nervous system. PNS stands for peripheral nervous system. Okay, a couple different parts of your peripheral nervous system. The first is the sensory. Okay, sensory, does anybody know, is that afferent or efferent?
Efferent.
Afferent. So sensory is going to be, your first part is going to be your afferent. Afferent is just a word that means all the information that's coming in to your system from the environment. Okay, your peripheral nervous system is going to be responsible for receiving information or sensory information from the environment. It's also going to be responsible for the motor response. We'll get there in a minute. Let's talk about sensory first. Okay. Sensory. What kind of sensory information do you receive from the environment?
All your 5 senses.
Tell me one.
Touch.
Touch. Okay. Touch is an important one. Let's go ahead and put touch in 2 different places. I'm going to say crude touch. Okay? And then down here I'm going to put fine touch. Okay? 2 different kinds of touch. There are 2 different kinds of touch that we need to know about because they travel through different pathways. Come in through your peripheral nervous system. What other sensory information do you receive? Say that again.
Temperature.
Temperature, yes. Let's go ahead and put So we have crude touch up here. So temperature travels with crude touch. Temperature. So by temperature, that means my ability to, y'all see that okay?
Yeah.
My ability to distinguish hot from cold. Okay, that's what I mean by temperature. It's not having a fever or anything like that, but it's not my ability to this is hot, this is cold kind of thing. Okay, that travels along with crude touch. It's information, sensory information that I receive from the environment. What else do I get? You guys are all looking at me. Pain? Pain's going to go with temperature and crude touch. So crude touch, pain, and temperature all travel together in the same sensory pathway. Sarah, you get that? You're looking at me? What sense am I talking about? Vision. Yeah, visual. Absolutely. Let's go ahead and put visual up here. Vision. Okay, vision is going to be one kind of sense. What else?
Smell.
Yeah, so let's say something fancy like olfactory, right? Okay, vision, olfactory. Taste, yeah. Good. So we got vision, we got olfactory, so we're thinking up in here somewhere. Taste, what other sense do I have? Auditory, awesome. I think I heard somebody say hearing, right? Auditory? Vision, olfactory, taste, auditory, olfactory. There's something that lives in your inner ear that helps with balance. Does anyone know what that is?
Vestibular.
Vestibular, perfect. There you go. Okay, so essentially vision, olfactory, taste, auditory, and vestibular, they're going to be what we consider our special senses. So I'll just label that up here. I'm choosing to use green for the afferent information coming in, sensory, and I'll continue to use green for the rest of the semester because that just means sensory to me. And that's your special senses. Okay? Okay, and down here we have another one that's complete. So crude touch, temperature, and pain all are brought into the nervous system through the same kind of pathway. Does anyone know what that pathway is? So when I say crude touch, temperature, and pain, that travels through something called the spino, S-P-I-N-O, thalamic tract, T-R-A-C-T. And I'll abbreviate that as STT. So there you go, first day of class, you're getting STT, spinothalamic tract. There's pain, temperature, and crude touch from the environment. Can you not read something? Is something difficult to read? Do you?
No, just not as well.
Okay.
Can you spell it one more time?
Spinothalamic, yes, S-P-I-N-O-T-H-A-L-A-M-I-C. Tract, T-R-A-C-T. Any other questions? Yeah, this is just information. This is other information that's coming in from the environment. Spinothalamic tracts would be one of the main sensory pathways we talk about this semester. There you are, getting on first day. Now there are other things. There are actually two other things that travel along with fine touch. Does anyone know what travels along with fine touch through a different pathway?
Like some soft.
Soft? No. Stretch? Yep, but not really stretch. It's close though. It's real close. There's something called, do you guys know what the word proprioception means?
This is where your body is in space.
Yeah, where your body is. So you know where your body is in three-dimensional space. This is called conscious proprioception. That means you're using your brain for it. right? That's conscious proprioception. So I'm going to put proprioception. Oh no, don't tell me I run out of proprioception. Okay, so traveling along together in this other sensory pathway, it's going to be fine touch, proprioception, as well as vibration. Okay, so fine touch, proprioception, and vibration all go together. They travel in through your PNS, through the same pathway, and that pathway, are you ready? This is the first time you're going to hear it. It won't be the last. It's called your DCML. It's dorsal, D-O-R-S-A-L, column, medial, lemniscus, L-E-M-N-I-S-C-U-S. Dorsal column medial lemniscus. And that is DCML. Okay? DCML, dorsal column medial is like middle, lemniscus, L-E-M-N-I-S-C-U-S. We'll talk about what these words mean here in a little bit. But this is something we're going to talk about a whole lot this semester, as well as next year as well, DCML. So, sensory information coming in from the environment. You have your special senses, so you have vision, you have auditory, you have olfactory, you have vestibular, and you have taste. You also have the ability to discern crude touch, temperature, and pain coming in through your SCT, your spinothalamic tract. You can also differentiate fine touch, proprioception, and vibration using your DCML, your dorsal column medial lemniscus. Okay, like I said, this is like a 360 overview. We'll get into much more detail, more than you probably want to over the course of the semester. You're going to know these very intimately by the end of the year. Okay? Questions about sensory? All right, now this is something I like to do to kind of introduce you to the function of the central nervous system. Okay? You have, let's say you're in your bedroom and you have a roommate, right? And your roommate is making cookies. Okay, so you're sitting there and you're reading or you're trying to read, but you smell these wonderful cookies happening, right? And you think to yourself, I just continue to study, or I could do something about this wonderful smell of cookies coming in here, right? So the cookies are coming in through olfactory sense, right? So everybody got that? Now, what kind of response? So your PNS has the sensory part, that's olfaction coming in. Now your CNS kind of interprets that, and then your PNS puts out motor activity. What kind of motor activity? Yeah, so voluntary movement. So it's going to be voluntary. There's going to be two kinds here. So you're going to have voluntary, and that's going to be skeletal muscle. Okay? I'm not sure if that color is coming through. I'm using red. Is it black and white, or is it me?
It's hard to tell.
I'll work on it. I can work with...
I can tell there's a red and green.
Yeah, so this should be green and this should be red. I'll have to work. It might be coming through as black and white. I can work with Wesley on that. Apologize. Okay, so what would be an example of voluntary muscle activity in response to the cookies?
Walking toward the kitchen?
Yeah, go grab a cookie, right? You get up and you go walk in, and that's going to be your voluntary response. In addition to your voluntary response, you also can have involuntary responses. In response to afferent information coming in, you have voluntary and then you have involuntary motor responses. So PNS is all about motor. What kind of involuntary responses might you have? Renee? Yeah, mouth watering, good. Excellent. So mouth watering is going to come under glands, so a glandular response. Okay? Your mouth might start to water before you even get up to go get a cookie. What happens if you're really excited to have a cookie? Yeah? Huh? Heart rate, right? You have a cardiac response, right? You have glandular response, you have a cardiac response. I can't wait to get that cookie, so my heart rate goes up. There's one more that's kind of a weird one, Jeff.
It's like the production of gastric acid.
Yeah, okay. So there's a technical term for involuntary muscle movement, and that's going to be Borgerismus. But what's going to happen is you have a smooth muscle contraction. That's your last voluntary response. Good. Excellent. People don't usually get that one. So there's going to be some smooth muscle contraction. And that's to get your GI system going. Yeah.
Does that smooth muscle like also influence like when your body allocates more blood toward your stomach? You can get hungry and stuff?
That's a little different. So we're going to talk about different kinds of smooth muscle responses throughout the semester. So just keep that in mind. But these are all the possibilities. So now, yeah? Right. No, Ben.
Yeah. What was like a reflex?
Reflex is going to be a stretch response. So there's different, basic, it's called a myopatic reflex. It's just a basic stretch reflex. We will talk about reflexes when we get to the motor under spinal cord. Okay? That's going to be more of like a voluntary muscle response as a musculoskeletal question. But it's involving the muscle stimulus. Okay. Any other questions? Does that make sense to everybody? So now, what's the function of the CNS? What's the function of the CNS? See, the PNS brings the sensory information in from the environment. PNS does what?
Louder.
Huh?
Processing.
I'm sorry?
Processing and
Processing.
communication with the PNS.
Yeah, it makes sense of it, right? It organizes the information and makes sense of it, and then it puts out, through the PNS again, a motor response. Okay, that motor response is either going to be involuntary or voluntary. Okay, voluntary is going to be your skeletal muscle. Your involuntary is going to be your cardiac, your glandular, or your smooth muscle response. Okay, so that's it. That's the function of the central nervous system. Just to make sense of the environment and put out an appropriate motor response in response to that. I can tell you, having worked with many people that have had brain injuries. Oh, I'm a neuro person. I love neuro rehab. My favorite patient population to work with is patients post-stroke and brain injury. Love that job. So I have worked with patients that had a brain injury, and they don't always put out the correct motor response in response to the sensory stimuli that's coming in. One example would be asking the patient to brush their teeth, and they reach for the razor and put it in their mouth. Right? So these things happen. Don't take your central nervous system for granted. It's an important part of your interpretation of what's going on around you. Okay? All right. Questions? Does it make sense? Big picture about what the nervous system is and what the nervous system does. Let's go ahead and move on to this next neuroanatomical relationship terms. So, we have this is a section through the brain. Does anyone know what section you're looking at? Yeah, what's that called?
A data section?
Sagittal. This is a sagittal section, right? This is going to be a sagittal section right through the middle of the brain. Okay, and again, if I have to label the parts, this is going to be. We'll worry about that later. Okay, this is the cortical region up here. Okay, what's this one in the back? Yep, that's your cerebellum. Okay, then here you have your brain stem. The uppermost portion of the brain stem is called your midbrain. Okay. And as far as neuroanatomical relationships in the brain are concerned, they change after the midbrain. Let me see if I can find a color. So I'm going to put this as the changing point here is the midbrain. There's going to be a spot just in the middle of the midbrain where these terms are going to change names. Okay. So if I had to label this, this is the top of the brain, so this is going to be superior. And this is going to be inferior. And I'm talking about the brain proper right now. Okay, just looking at everything above the midbrain. Okay, we have the superior surface, we have the inferior surface, we have the anterior, it's here in the front, okay, and then we have the posterior, it's there in the back. Color. Everybody got that? So you've got your, in the brain proper, in all areas above the midbrain. If you want to talk about the relationship of structures to each other, there are very specific words to use. And only in the brain, the superior surface is also called the dorsal surface. Okay? So essentially, if this were an animal, the head would be over here and this would be its back. So superior for the brain is dorsal. Okay, above the level of the midbrain, inferior, well, superior is dorsal. What would you think inferior would be? Ventral. There you go. So we have dorsal and we have ventral. And I can tell you the anterior is rostral, R-O-S-T-R-A-L. Anterior is rostral. What's the posterior going to be? Caudal. Good. Caudal. So, above the level of the midbrain, if you're superior, you're dorsal. If you're inferior, you're ventral. If you're anterior, in front, nose, rostral, caudal, in the back. Okay? There I see that. So, and what happens is it changes when you get below the midbrain. So essentially, you take the animal, if the animal is walking this way, and this is the back of the animal, you're going to flip it up this way. So here is still, so they're all the same. So there's going to be superior, below the level of the midbrain. Okay? There's also going to be an inferior, below the level of the midbrain. And then you have, as well as anterior, and then posterior. Okay? So, does everybody see that? So same directions, but now the names are going to change a little bit. So as far as, let's go ahead and give it a different color. As far as below the level of the midbrain, now superior is going to become rostral. Okay, which means that the inferior is going to be caudal. So another way to think about that is C1 is rostral to T1. T8 is caudal to C2. Something like that. It's just a way to think about it. Yes, Josh?
Why did it switch? Like, why is rostral anterior?
Some anatomist decided it was supposed to, I don't know.
Sick.
Probably the only explanation I've ever heard is they think of the brain as something very separate from here. And if you take the brain and you flip it this way, just take the brain and flip it this way, that's what you get going down. Because there's actually, at the level of the midbrain, there's like a change. You go back down. So, but I don't know the reason why somebody chose to do that, to confuse students. I don't know.
Yeah.
So, just the way it is. So, as far as below the level of the midbrain, superior is going to be rostral, inferior is going to be caudal, and anterior now, the front is going to be belly side, right? Now it makes sense. Now it's going to be ventral. And then the back side, if you think about the back of the spinal cord, that's going to be dorsal. That's posterior. Okay, so just different ways to categorize structures in relationship to each other. They have different names depending on whether you're above the level of the midbrain or below the level of the midbrain. Questions about that? Yes. Yeah.
I can't really tell. Are they all the same color, like green?
Yeah. So I tried to put so green up here. There's no real reason. I just tried to differentiate. Above the level of the midbrain is green, and then below the level of this should be purple. I tried to make it purple below the midbrain. Colors have a reason. I'll try and say that. Any other questions? Okay, so just some basic terminology. Yeah, let's go ahead and do this. Let's go ahead and move on to the parts of the brain. Okay. And I also have my very special guest here. There he is. He's not behaving very much here. Let's see if I can rotate him over. I don't know why that's doing it. There he is. Okay. This is my brain stuffy. Okay. Somebody gave him to me years ago, so I think he's very useful. Okay. When you think about the basic parts of the brain, you have, well, here's nice red, he's got a nice red brain stem down here. So here's the cortical region, all through in here. Okay. He's got a nice brain stem, which is shown in red. He's got a nice cerebellum, kind of striated like you'd expect the cerebellum to be. That's kind of what it looks like. When we pull the brains, you'll see that. Okay. He also has these like in some places like small ridges. Okay. And then in other places like this one right through the center, you can see all the way through here, there's a really big invagination, a groove. Okay. Different grooves and in between the small, you have the like folds or ridges here. Does anybody know what those are called? Let's start with the small sulci. Yeah, so sulci are going to be the grooves. So by that, these little guys are called sulci. Okay, they're going to be the little grooves. Sulci are the small grooves. Okay. In addition to the sulci, you have these great big old grooves that typically will separate. So this separates left from right hemisphere, and then there's another one over here that separates temporal from others. Does anybody know what the bigger kind of groove is called? It has a special name? Fissure, yeah. So your fissure, F-I-S-S-U, that's going to be your large groove. Okay, just a very large invagination. Like I said, the fissure, the sulci just separate individual folds or ridges in the brain. And then the fissures typically will separate lobes from each other. Okay, so just basic nomenclature. And also you have these you can call them ridges, R-I-D-G-E-S, or folds. Those have a word too. Does anybody know? So like if I had to point to these ridges here or folds in between this whole area, does anybody know what that's called?
Apex.
No, not an apex. Gyri or gyrus. Okay, an individual one is a gyrus, but in general, these ridges or folds are called gyri. G-Y-R-I. Okay, And if you have one in particular, and that's plural, singular is going to be gyrus, G-Y-R-U-S. Okay, so in general, your small invaginations are going to be called sulci. The big ones are known as fissures. And then the ridges or the folds in between your sulci are known as gyri, or singular is gyrus. Okay, now as far as major landmarks in the brain are concerned, we have one big one. We're going to talk about this guy a lot, and he's right here in the middle. Okay, right down here. This one is going to be a kind of groove. Has a special name. It's called your central sulcus. So sulci are many. This is sulcus is one. So your central sulcus is nothing more than this line that I've drawn here. And it's going to separate a couple of lobes in the brain we're going to talk about in a little bit. Okay. And then this is actually looking at the outside surface of the brain overall. And I like to think about this as a boxing glove thumb. So if I put my thumb right here, this piece of the boxing glove, this is a kind of fissure. Okay, does anyone know? It's on the lateral surface of the brain. It's a kind of fissure. Or sulcus? Lateral. Yes. You also have another one that separates left and right portions of the brain here, right down the middle. That's going to be here. It's going to be your longitudinal fissure. And these words, they're just major invaginations that you're going to see if you look at the surface of a brain. Yeah, so we're right now at 1:50. So let's go ahead and take a 10-minute break and then regroup. Okay?